The Zika virus that headed that science list is still very much a threat, and scientists are now warning that Australia may be at risk of a widespread outbreak of Zika or dengue fever unless more is done to stop exotic mosquitoes arriving on our shores. Dr. Cameron Webb is a medical entomologist at New South Wales Health Pathology and at the Sax Institute for Infectious Diseases and Biosecurity at Sydney University.
We've got plenty of mosquitoes in Australia. We've got over 300 different species that are found here. And some of them bite us, they're pests, and they can also spread some of our local mosquito-borne pathogens like Ross River virus. What we're really concerned about are some of the mosquitoes that aren't actually here in Australia yet. Mosquitoes like the Asian tiger mosquito that could be easily established in our major capital centres. And this mosquito can transmit pathogens like Zika virus and dengue. We don't want that mosquito in our cities because then we may need to deal with outbreaks of Zika, dengue or maybe even chikungunya virus.
What are the procedures in place now to stop them setting up home here?
We've got great systems in place by the Department of Agriculture and Water Resources who monitor the movement of mosquitoes at our airports and seaports. But what we're worried about is what happens if the mosquito pops up in our suburbs. Australians love travelling, they're visiting friends and family in Southeast Asia and the Pacific, and if somebody brings back a souvenir or a belonging that contains some of the eggs of this mosquito, if the conditions are right, they can hatch out and start a new establishment of a population in our suburbs. So what we're trying to do with health authorities is to build capacity to respond to those introductions and eradicate them if it's possible to do so.
So what extra measures does that require?
It requires building capacity amongst our health authorities and local governments, changing the focus of our mosquito control and surveillance. At the moment, we're really great at controlling mosquitoes and monitoring them when they're in our wetlands, but we need to shift our focus from the swamps to the suburbs, and that means getting into people's backyards, using different types of traps. And most importantly of all, it's really about being prepared to respond quickly if detection is made.
Sure. There are cases of dengue fever regularly in far North Queensland. Mosquitoes are already here that do pass that on from person to person.
Yeah, that's very true. So we've got a mosquito called Aedes aegypti that's currently found in central and far north Queensland, and yes, that's responsible for local transmission of dengue. Travellers come back infected with the virus, they're bitten by those mosquitoes in those areas, particularly around Townsville and Cairns, and they can pass it on to residents. The buffer we have in our cities is that we don't think that mosquito could be established long-term in some of our southern major metropolitan areas. For other mosquito species like the Asian tiger mosquito, it's a different kettle of fish. They're much more tolerant of these cooler climates. They could become established in cities like Sydney, Melbourne or Perth.
You've also looked at the best and the most effective insect repellents. What have you found there?
There's a range. There's over 100 different repellent formulations you might find in your supermarket or your pharmacy, but they all contain a couple of key ingredients that really help protect against mosquitoes. So anything that contains DEET, picaridin or oil of lemon eucalyptus, that will provide the longest lasting protection. But it's not just what you choose, it's how you use it. So making sure that you apply a nice thin cover over all exposed areas of skin, that will provide the best protection against biting mosquitoes this summer. And if you can protect yourself against mosquito bites, you can protect yourself from mosquito-borne disease too.
Cameron Webb, thank you.
Thank you.